Again, my name is David Muhammad. I'm the Executive Director of the National Institute for Criminal Justice Reform. I've spent the last 22 years of my life working to reform the criminal justice system, as well as to develop effective gun violence reduction strategies. So often, these two have been separate parts of my life, but really, they're the same thing. It's about reducing the size of our criminal justice system so we're not having this huge footprint and negative impact on massive amounts of people unnecessarily. And it's also providing the appropriate amount of intervention, supports, opportunities to individuals to help them make better decisions and transform their lives, whether that be to change the criminal justice system or to reduce gun violence in so many of our cities that are plagued by high rates of violence. Oakland, California, where I was born and raised. I've also been in the system, the deputy director of the DC system and juvenile justice, and New York City's head of adult probation, and back at home in Oakland, running the probation department, all for the purpose of really reforming the system from inside. I did that for a decade and have spent the last 10 years around the country, both trying to transform the way in which we administer the justice system, as well as helping cities to develop effective strategies to reduce gun violence. At the end of 2012, the city of Oakland, California had once again had a very high rate of gun violence, earning some dubious distinctions of the most violent city in California and the top 5 most violent city in the country. And so at the end of 2012, we decided to implement a strategy whose purpose was to reduce the gun violence in the city of Oakland. So the gun violence reduction strategy, which is also referred to as CeaseFire, and we're moving away from that name, to be quite honest, because there are some cities in the country that use that name but don't do what we have implemented, which is a comprehensive set of programs and strategies to provide effective services and to provide focused enforcement. What we found in Oakland is what I have found in every one of the many cities that I have been to in the last several years, helping them to develop a strategy like this, is the simple understanding that you have to be clear about what you're trying to achieve. I developed this basic continuum to help folks understand where do they want their work to land. Because the problem is, many things fall under the broad category of violence prevention. I've heard everything from planting trees to universal pre-K to lead paint abatement, and all of those have some research that says that they result in gun violence prevention in 10, 15, 20, 25 years. And so this basic continuum talks about what's prevention, focusing on at-risk youth at a particular time in hopes that in 10 to 15 years they don't become the people engaged in immediate gun violence. The work that I'm going to talk mostly about in the middle, about intervention, reducing gun violence right now. And then community transformation, transforming neighborhoods and communities so that they don't need a gun violence intervention program. And just a note on this. I want East Oakland to not need a gun violence reduction strategy like a neighborhood in Oakland called Piedmont. Right? I want North Philly to not need a gun violence reduction strategy like some of the neighborhoods around here don't need a gun violence reduction strategy. That is the long-term strategy so that these conditions of concentrated blight and neighborhood, concentrated poverty and neighborhood blight and proliferation of liquor stores and low-performing schools and easy access to guns and high incarceration rates and easy and readily available access to guns and drugs don't exist anymore. And so, but I also have to advise cities all the time on this most basic of principle that 100% of the cities, and there have been many that I've worked with, do not get at first, which is your actions must be aligned with your desired outcomes. Now, that is a rather basic principle, but I tell you what I get. City Council Member X says we've got to reduce gun homicides in the next year. We're going to launch a mentoring program for middle school students. Right? Some of those who get it just laughed. A mentoring program for middle school students is great. We need it. It will never get you gun violence reduction in 12 months. But we continue to do things and either don't know or sell it to the public as if this is an effective strategy to immediately reduce gun violence. An effective mentoring program focused on the right group of middle school students might give you gun violence reduction in 10 years. It'll also give you some great outcomes in the next 6 months and 12 months. It's just not gun violence reduction. I'm talking to a group of people who do this work and I deliberately want to hit them hard about gun buybacks or midnight basketball programs. Those are great. They're good feel-good programs that you should do. Just don't say they're going to actually end up reducing gun violence. Your actions should produce your desired outcome. All right. So, quickly, what we did in the city of Oakland was very clearly we wanted to reduce gun violence immediately. 4 core pillars of the strategy. 1, data-driven identification of the people who are at the very highest risk of being involved in gun violence. And we have the data, every city does, but we have the data to be able to pinpoint the people who are most at high risk of being involved in gun violence. 2, direct communication, informing them of their risk, like a public health model where you're informing people you have the risk factors that make you much more likely to either be a victim or perpetrator of gun violence. Not scared straight, direct and respectful communication to those individuals. 3rd, offer serious and intense services, supports, and opportunities to provide to those individuals to give them a real opportunity out of that risk level of gun violence. And 4th, focus enforcement, so that law enforcement isn't arresting any and everyone for every little infraction, but to be very focused on the gun violence, which should have a net effect of reduced arrests and reduced gun violence. So, in the city of Oakland, we have several partners in this work. There's no one agency that leads the effort. There's several partners. So I'm going to quickly go through those 4 pillars. 1, data-driven identification. So we did a deep study in the city of Oakland of every single homicide for 2 years to see what were the risk factors of the people involved. 60 to 70% of everyone involved, either as victim or perpetrator, had nearly the exact same risk factors. And the big headline to come out of that study was the average age of a homicide suspect was 28 years old. Had you asked citizens, if you'd asked residents in the city, you would have told you a teenager. Almost every single city is the same. Philadelphia, the average age of a homicide suspect is well over 21 years old. So, in Oakland, there's about 415,000 people. About 20,000 are under some form of community corrections supervision, probation, parole, and those types, way too many. But only about 300 have these risk factors that make them extremely at high risk of gun violence. A very small population that we can engage. The risk factors that they have, and so many people say too many people have these, it's not true. Too many people have 2 or 3. Very, very few have 4 or 5. And when you have these factors of 18 to 35 years old, significant criminal justice involvement, so in Oakland has 7 or more previous arrests prior to the shooting incident, associated with an active crew gang group. We don't really have traditional gangs in Oakland, so we call them crew gang groups. And that's just for identification purposes, not for some gang intervention, gang law enforcement work, but so that we can say these are people we can identify so that we can provide appropriate intervention and support. One of the biggest risk factors nationally of being shot is that you've been shot before. And then people who have a fellow friend, i.e. group member who's been shot recently. 2 is direct and respectful communication. Sit down with them and explain to them, here's the risk factors you have. You are likely in the next 12 months without changing anything to either shoot someone or be shot. To provide direct and respectful communication. 3rd is to provide intense and real support. Not handing somebody a card or a piece of paper with a bunch of organizations that they can call. So in Oakland, we have this community of support, 14 people whose full-time job is to be in relationship with the people that we've been identified as at high risk. And they are provided stipends for their time and to engage. Not huge amounts of money, but amounts of money to get their attention, that we often say come for the incentive, stay for the relationship. They have employment opportunities, but the biggest thing they have is life coaches, credible messengers, people who have often been incarcerated themselves or from their neighborhoods, who have similar lived experiences, transform their lives, and now their full-time job is to be in relationship with these individuals who've been identified as high risk. So the strategy is identify those individuals, locate them, and then engage them. And what engagement looks like, we had to change what traditional case management looks like. It's not just service brokering. These are people who have been offered services before, but to be in a relationship with them. We want you to know them, that we want them to trust you, and so that you can use your influence to help them make better decisions. And that's the mentality shift. And then provide what service supports and opportunities they might need. Housing, employment, education, if there's specialized needs of mental health or drug treatment. All of those must be available to this population. And then focused enforcement. To really, and in Oakland, we've really moved. So Oakland used to arrest about 33,000 people every year. Last year they arrested, I think, 9,000 people. A massive reduction in arrests with using a strategy for the past 7 years that has enforcement as a part of the strategy, but extremely focused, not arresting everybody for everything. And we have a working process. This is just a list of a bunch of meetings to make sure we stay on task. But this is the proof is in the pudding. We implemented at the end of 2012. And 6 consecutive years of decline, half of our shootings and homicides were cut. We cut them in half and are still going. The good thing is this strategy is still the #1 strategy in the city that has the focus of the mayor, the police chief, the service providers. Even though in the last 7 years we've gone through 2 mayors and 6 police chiefs, this has been still the city's #1 program for violence reduction. Last thing is the cost of the program pales in comparison to the cost of violence. So my organization, the National Institute for Criminal Justice Reform, has done a number of studies of cost of violence, deep studies in a local area to say what does it cost. These are the different cities, but this is a better look at Dallas, for instance. That when a shooting occurs, the police respond, ambulance responds, fire, EMT respond. Often the DA responds to the scene if it's going to look like it's going to be a homicide. There's an incarceration, there's a hospitalization, there's a trial, sometimes there's a funeral and an autopsy. Those government costs, on average, are more than $1 million per shooting. The controller in Philadelphia recently did a study that came out that said for every injury shooting in the city, within 11 blocks, the property value within that 11 blocks drops 2.3%. So you can imagine then you have the tax assessed on that property value reduces, so the city is losing real money, and that's separate from the direct costs that I just listed. So if any politician says we don't have the money to do an intervention program, explain to them that you have more than the money to do, because it more than pays for itself. The great thing is it's been proven effective. It's not rocket science. It is real work. It is hard work, but there has to be care that people are dying every day, being shot every day, and it's not just in some neighborhood we don't want to think about or that is disposable. The great thing is we have effective ways to provide real support and focus on the folks at the greatest need that can transform the situation and reduce violence, while simultaneously we should be working to transform communities so that they don't ever need a strategy like this. Thank you very much.